Hi, my name is Nitil and I'm excited to present the topic of combating global teen mental health issues holistically. Just a little bit about me. I'm a rising senior at Biotechnology High School, and I'm hailing from Marlborough, New Jersey. So some activities that I like to do outside of school is that I'm the cadet captain at my local EMS squad called Marlborough EMS. I'm also the co-founder of the Shanti Mental Health Initiative, which is an international organization with a focus on nurturing social and physical health in order to alleviate and prevent mental health issues in teenagers. In addition to this, I'm also the board member of my school's mental health and wellness committee, as well as a varsity tennis player. In terms of interest and future plans, in college, I hope to study as an undergraduate major in the field of global health or public health, and then on a pre-med track in hopes of becoming a doctor in medicine and specializing in pediatric neurology. All right, now that we know a little bit about me, let's get started on our actual topic. So let's start with the question, what is mental health? So the CDC defines mental health as mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. In this presentation, we're going to focus specifically on adolescence and how improving our social well-being as well as psychological and emotional well-being overall improves mental health. That being said, let's move into how teen mental health has become almost a global epidemic. Teen mental health is affecting millions of people around the world. Globally, 1 in 7 10 to 19-year-olds experience a mental health disorder, accounting for 13% of the global burden of disease in this age group. And almost all of these mental health disorders are going unrecognized and untreated, especially in nations where mental health is stigmatized, as well as there's not enough resources to contribute to mental health healthcare. Depression, anxiety, and behavioral disorders are among the leading cause of illness and disabilities among adolescents worldwide. Suicide is the fourth leading cause of death among 15 to 29-year-olds. And all of these mental health issues don't just affect the adolescent population in isolation. They also affect the adolescent population once they grow up and move on into the workforce and into adulthood, impairing both physical and mental health, limiting opportunities, and leading to unfulfilling lives as in adults. These mental health issues are widely spread and prevalent throughout all nations in the world, and it is honestly a shame that there is not as much help and as much resources being dedicated to supporting the cause as there should be. Now, let's take a look at what actually causes and exacerbates these issues in our communities. So some causes and exacerbations of teenage mental health issues. So let's start with causes. There's exposure to adversity, whether that be stressful tests or a death in the family. There's also pressure to conform with peers regarding social media and other various sources and bullying. Exploration of identity, as adolescence is a phase where people are growing and learning more about themselves and the way they want to impact the world around them. Social media influence, like I touched on before, the way that social media is dictating the mental image of all of our peers, the quality of their home life, relationship with peers in school, once again touching back on the bullying idea, the idea of harsh parenting, especially in nations in the Eastern Hemisphere, where they have very specific expectations and high expectations of what their child should be, and it leads to this overbearingness and pressure on the students, causing stress and panic, leading to these mental health issues. In terms of exacerbations, these are larger on a scale of like the nation itself as well as the world itself. There's a lack of mental health resources out there in certain countries, especially in the United States. This is also exacerbated by socioeconomic issues. There's been a direct correlation between mental health issues and those in lower socioeconomic backgrounds. There's a lack of mental health policy in most nations, especially in the United States. And there's no specific commitment from governments. And in addition to that, there's also a discrepancy in the way various countries execute their mental health policy, as there's a heavy stigmatism against it in many nations. With all this being said, it begs the question, if governmental policies are lagging behind, how can teens help prevent these mental health issues in their own community? Well, one way they can do this is by impacting their peers and themselves, by looking at health holistically. According to the WHO, health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So if we take a look at our health triangle, to prevent mental health issues, we have to support and bolster our social and physical health in order to support our mental health. Looking at the intersection between mental and physical health, regular exercise has many benefits for your mental health. It releases feel-good endorphins like serotonin. It helps you take your mind off worries, helps you gain confidence, and also cope with stressors and issues in your life in a healthy way. There's two methods of doing this, either structured exercise, such as going to the gym, playing a sport, and others, or just getting outside and moving around. Studies show that if you spend 10 to 15 minutes exercising or moving around a day, you get all these benefits of physical health. Moving on to the intersection between social health and mental health. Social isolation has been shown to directly contribute to depression, whereas positive social interactions have fostered a sense of belonging and help you contribute to enhancing your self-esteem, all things that are hallmarks of good mental health. It also helps you develop a strong social network, which allows you to have emotional support as well as provide emotional support for others, and also help you and other individuals cope with stress. And the stress relief through social health is one of the major ways that you can alleviate stress on your mental health. So now let's look at what teens can actually do to improve their physical and social health in order to bolster their mental health. So in terms of what teens can do, in terms of physical health, they can join local sports teams or clubs or even create them. They can also go for regular walks or runs in local parks, organize informal activities with friends such as bike rides, hikes, yoga sessions, beach volleyball as you see in the image, spike ball, I know that's all the craze nowadays. Anything just to get yourself moving will help you in the long run. They can also foster healthy eating habits, as there's a positive correlation between healthy eating and improved mental health. In addition, in terms of advocacy, teenagers can advocate for improved community resources for physical activity, such as introducing and building new parks and lobbying into their local government. In terms of social health, teenagers can volunteer for community service, as it is shown that actually volunteering has shown a positive correlation to positive mental health. You can also attend festivals, cultural events, or neighborhood gatherings within your own community to strengthen those ties. You can also participate in youth leadership programs, start and join study groups, or even online communities like our favorite GHLC Discord. To wrap up this discussion, mental health is a global threat affecting the entire teen population of the world. Solving mental health requires a comprehensive approach, as mental health is intertwined with all the aspects of health, including physical and social. Recognizing this interconnectedness will create a protective buffer which can prevent the onset of severe mental health conditions in our teenage population. With all that being said, it is a responsibility for us teens to help bolster our own individual community's mental health before governmental policy becomes involved and is implemented. These are some of my references. And I'd just like to acknowledge my family and friends for supporting my endeavors in improving mental health in my community, as well as my school counselors and psychologists for helping me implement some of my mental health prevention ideas at school, as well as the Global Health Leaders Conference for giving me this platform to speak on. And once again, thank you to the audience for listening. This is some of my contact information. Thank you again.